My name is Nadima Miller. I'm 40 years old. I've been nursing for the past 14 years. In March 2020, my nursing career changed dramatically with COVID-19 that hit Cape Town. Since then, nursing has changed a lot, the way we nurse our patients, because nursing is ultimately a caring profession, and COVID-19 has taught us to stay away from each other, distance ourselves from each other, which has been very challenging to me as a nurse, because I'm the type of nurse who would sit with my patients, talk and interact, because I believe in holistic nursing care. You don't just nurse with medication, you nurse with your mind, you nurse with your eyes, you nurse with your ears, with your hands. And that to me is holistic nursing care. And with COVID-19, that it has had such a vast impact on all of us, whether we were affected or infected. We have all been affected by COVID-19 in some or other way. My greatest challenge is, I think, the fear of not becoming infected myself, but taking it home. I think that is how most of the nurses feel, taking it home and in the result causing our families to become ill. I think we can all just imagine the guilt that would surround us. But I have had a personal experience that people are also getting better. If I can just mention that it was 2 weeks ago, I personally discharged 5 patients on one day who were infected with COVID-19, but they walked out of the healthcare institution. And that to me is positive. We need to create an awareness that this thing is real. People are getting ill, but we also need to put in some positivity that people are getting better. Malamed has and is still doing their best. If I listen to how other people are talking about the lack of PPE, it gives me some sense of security to know that we are covered with PPE. It gives you some sense of that you are safe in the environment, because the nursing oath is very significant to me as a person. And there's one of the lines there says that nothing will stand between me and my patient. And that is the one thing that wakes me up in the morning. Yes, it's happened where the family doesn't even get to say goodbye to their loved ones. And it's a lonely virus, because I'm nursing this patient, but the protocol teaches me stay away. And also for the family. So there's no way of the family interacting with each other. And if I look at my patients, they're not even physically, just physically isolated. They are mentally, they are psychologically, emotionally, they are isolated. So we do accommodate our patients, the ones who can talk. When we use the mobile phone, we make a call for them just to say hi. But sometimes they actually just need to see the face. So even if it's, we use the internet just to accommodate those patients in that way. The biggest challenge is you can never know where you pick it up. It could be here. It could be dormant, and that is the sort of scary part. First of all, the virus doesn't just portray itself in cold symptoms, flu-like symptoms anymore. It can come in any form. You can be asymptomatic where you look perfectly fit and, not unwell. And also my family, there's sometimes that I feel they're scared of me, because the first thing they'll ask me, Mommy, where did you work? And I don't know if I must feel offended. I don't know how to feel. But I can understand that their fears also, because I see all this negativity. Malamed Gatesville particularly is a big family. It's a family. And if I say family, I put emphasis on family. We actually take care of each other. We pray together, we laugh together. A big coping mechanism is actually laughing. We laugh, we joke about things, even though we know it's serious. The idea is not to laugh about things, but that is a great stress reliever. So what we do is we contact each other often. If I know my colleague is not well, I make a point in asking, how are you? Are you eating? Are you sleeping? So we have become a closer family now more than ever. This too shall pass. I'm committed to honor the oath that I've taken. I love taking care of people. I love getting up in the morning and knowing that I can make, even if it's a little difference. I say again, nursing is not to me about handing out tablets to people. I tell myself every day that people are here because they are ill, they are vulnerable, and if they can't see, I'm the eyes, the ears, the hands. I need to be whatever I need to be. So I'm going to be nursing until I can't nurse no more.